प्रोसीजर ऑन हिस्टेरेक्टमी इन BSc नर्सिंग। सब्जेक्ट है इसका मैटरनल। हिस्टेरेक्टमी का हम सबसे पहले देखेंगे इंट्रोडक्शन इसकी। रिमूवल ऑफ यूट्राइन इन द डेफिनेटिव प्रोसीजर फॉर ट्रीटमेंट ऑफ सिम्टोमेटिक लियोमेयोसिस। Hysterectomy should also be considered in the event of rapidly enlarging tumor, in which case two responsible likelihood of malignancy exist. Patient satisfaction in hysterectomy is very high, but accompanied by the surgical morbidity of the major operation. Some women have been found to impress post-hysterectomy regret regarding loss of fertility. Therefore, adequate post-operative counseling is essential. Definition is कि a hysterectomy is a surgical removal of the uterus. It is very common procedure performed for the variety of indications. In this article, we shall look all the classifications and indications and complications of the hysterectomy. Classification is कि a hysterectomy can be classified by an amount of the tissue reselected. Total hysterectomy आएगा removal of the uterus and the cervix. Subtotal hysterectomy removal of the body of the uterus only, leaving the cervix behind. Total hysterectomy and removal of the uterus, cervix, fallopian tubes and ovaries. Radical hysterectomy आएगा removal of the uterus and cervix, the peritoneum, a vaginal cuff and part or of the whole of the fallopian tubes. This procedure is carried out in selected cervical cancer. The ovaries may be removed or may be left behind depending on the patient's age. Indications is कि a hysterectomy has a number of possible indications. The following are the most common, but this is not an exhaustive list. Heavy menstrual bleeding, pelvic pain, uterine prolapse, gynecological malignancy. Contraindication है accessibility of the uterus, patient preference, extent of intrauterine disease. Benefits है इसके short inpatient treatment duration compared with abdominal, allows the possibility to diagnose and treat other pelvic disease, less bleeding, fever, infection compared with abdominal surgery. Disadvantages इसके increased length of surgery, requires a high degree of laparoscopic surgical skills, may have a higher risk of bladder and ureter injury. Procedure है इसका there are three main approaches to the hysterectomy. The principle and steps of each approach are the same but in different orders. Abdominal, via an incision of the abdomen. Vaginal, via incision through the superior part of the vagina. Laparoscopic, via small incision in the abdomen and using laparoscopes and the uterine manipulator. Abdominal hysterectomy procedure. An abdominal hysterectomy may be performed through a low transverse incision or through a midline incision. This depends on the indications and the size of uterus. For example, a large fibroid uterine muscles necessitate a midline incision. The steps for the simple total hysterectomy after the abdomen is opened are the follows. The round ligaments are divided if the tubes and ovaries are to be removed. The infundibulopelvic ligaments are ligated and tight. Should be identified. The utrovascular peritoneum fold is divided and the bladder deflected down past the cervix. The parametrial tissues are divided. The uterine vessels are ligated and tight. The paracervical tissue and ultrosacral ligaments are ligated and tight. The vagina is open and the uterus and cervix removed. The vagina is usually closed with the absorbable suture. Hemostasis confirmed at all particles. The abdomen is closed. Laparoscopic hysterectomy procedure. The above steps are identified for the total laparoscopic hysterectomy, except that the procedure is performed through several very small incisions. Using a laparoscopic instrument, the specimen is removed through the vagina. Bipolar energy may be used for coagulation of blood vessels and scissors for dissection, or more modern energy devices may be used. The vaginal vault may be closed laparoscopically or vaginal. It can also be performed using a robotic platform. A general anesthetic is required for abdominal and laparoscopic hysterectomy. Third, a vaginal hysterectomy. For a vaginal hysterectomy, no abdominal incisions are made and the procedure are performed entirely through the vagina. The steps are as follows. Local anesthesia and infiltrated around the cervix. A circumferential incision is made around the cervix. The bladder is dissected of the cervix and reflected upwards. The anterior peritoneum is opened by the cutting of utrovascular peritoneal fold. The pouch of Douglas is open. The ultrasacral ligaments are ligated and tight. The uterine arteries are ligated and tight. The round ligaments are ligated and tight. The tubes and ovaries may be taken in this. It may be preserved. The uterus and cervix are removed. The vagina is normally closed on the edges, sutured to ensure hemostasis. The uterosacral ligaments may be fixed to the upper vagina to prevent prolapse of the vaginal wall. Vaginal hysterectomy may be performed under the regional anesthesia. A general anesthesia is not required. Nursing management of post-operative patients. The physical preparation of the patient undergoing a hysterectomy is similar to that of patient undergoing a laparotomy. The lower half of the abdomen and the pubic and perineal regions may be shaved, and those areas are cleaned with soap and water. To prevent contamination and injury of the bladder, on intestinal tract and bladder need to be empty before the patient is taken to the operating room. An enema and an antiseptic douche may be prescribed, and evening before surgery to the patients may be instructed to administer these treatments at home. Preoperative medication may be administered before surgery to help the patient relax. Postoperative assess the signs of hemorrhage. If it is more common after vaginal hysterectomy than after abdominal hysterectomy. Encourage turning, cuffing, deep breathing, early ambulation. Assess incision and bowel sound after shift. Assess vaginal discharge. Instruct the woman in perineal area. Assess for complications including infections, shock, and hemorrhages and pulmonary embolism. Once the catheter has been removed, measure the amount of urine avoided. Monitor vital signs every 4 hours. See accurate lungs every shift and mere intake and output. Encourage fluid intake. इसकी बायोग्राफी है जवाब एमिमा टेक्स्ट बुक ऑफ मिडवाइफरी एंड गायनोकोलॉजिकली नर्सिंग फर्स्ट एडिशन लोटस पब्लिशर 2018 पेज नंबर है इसका 586 से 5